Scanning the room. Our patient. Here's our MAR. Nothing on it.
Okay, so here I have Mary Sanford, date of birth 11/12/98, no allergies. She recently had her first vaginal delivery 6 hours ago. She has not voided since then, and that's after her Foley was removed prior to pushing. Her heart rate's a little elevated. She has normal vital signs. She did say that she's in a little pain in her vaginal and peri area from birth. She rates it about a 4 out of 10, so we're just going to check it for any redness and swelling. She has an order right now for a straight cath, so we're going to go ahead, introduce ourselves to the patient, and see what we got from there. So I'm going to knock, 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 provide for privacy, hand hygiene. Hi, I'm Maddie. I'm going to be your nurse today. Can I have you verify your name and date of birth, please?
Mary Sanford, 11/12/98.
Perfect. Mary Sanford, 11/12/98. Do you have any allergies that I need to be aware of?
Nope, not at all.
All right. So I'm in here because we do have an order to insert a Foley catheter to help express your bladder. I hear it's kind of causing you a little bit of discomfort.
Yeah, I just haven't been able to void since I had my epidural. Yeah, it kind of building up a little bit.
Okay. I did get hand doc report from the other nurse that when she bladder scanned you, you had about 500 cc's of urine in there. Are you okay if I go ahead and just feel your abdomen and check your peri area? Because they said there was some redness and swelling too.
Yeah.
Okay, I'm gonna grab a pair of gloves first. And then I'm gonna raise your bed. I'm going to start by exposing your abdomen and palpate that first. And then I'll go ahead and I'll check your peri area so I'm not bringing any dirty germs up to your abdomen, okay? All right, just gonna expose the area I need for now. All right, let me know if you feel any pain or discomfort, okay?
It's not really discomfort. It's just more or less I feel full.
Yeah. Well, I am feeling that your bladder is kind of full. I'm going to go ahead and check your peri area for redness and swelling, okay?
Yeah.
I do see some redness. I do see a little swelling. We'll go ahead and I'll have a CNA come clean you up right before I come do your straight cath, all right?
Yeah, that sounds good.
Okay, do you have any questions for me before I leave?
No, I don't think so.
Okay. I'm going to go ahead and put her bed back into a safe position. Once it is down in a safe position, I'm going to make sure she has her side rails up and I'm giving her call light. All right, then I'm going to remove my gloves. And now I'm going to be back to my MAR. I have my catheter kit. It is intact, unused. Expiration date is 3/1/27. Let's go ahead and review our patient chart one more time. Mary Sanford, 11/12/98. No allergies. Pain and swelling in her vaginal area. Unable to void for the last 6 hours. We're going to go ahead and give her some comfort there. Let's go ahead and get started. Knock, knock, knock. Provide for privacy. I'm going to hand hygiene. All right. Hello, it's Madison. I'm back again. Can I have you verify your name and date of birth, please?
Mary Sanford, 11/12/98.
Perfect. I'm going to check her wristband. Mary Sanford, 11/12/98. Okay, so before I get started, I just want to go over a couple things. Since they removed your Foley, which is a good thing, if we were to leave it in too long, there is the risk for catheter-associated urinary tract infections. And with the straight cath, we'll insert it, it will express your bladder, so urine will flow out, and then we'll remove it right away. But with the Foley, it stays inserted to constantly express your bladder. So with this, it'll be in, it'll be out, and I'll be out of your hair. Does that sound okay?
Yeah.
Okay. I'm gonna go ahead and raise your bed to a safe position for me. And just to verify your allergies one more time, I do have to swab you with some betadine. You don't have any allergies to that at all, do you?
Nope.
No? Perfect. Okay, my bed is up into a safe position. I'm gonna fix your pillows for you. It looks a little bit uncomfortable. Okay, I am going to pull down my blanket So I'm gonna have you in a butterfly position. It might be a little bit uncomfortable, but it's just to ensure that I have the best view possible. And I do see that the CNA came in and she put down a clean check pad under you. Are you okay in that position for now, Mary?
Yeah.
Okay. I'm gonna go ahead and have my catheter. I'm going to open it away from the patient. Discard. Totally missed the garbage, but that's okay, I'll clean up later. I'm going to grab my gloves, and I'm gonna ask that my video come over here, please. I'm going to open them, and since this is all on the outside, I'm able to touch this. I'm going to open. It's not gonna stay open, they never do. And then I'm going to stick my fingers underneath the flap, and I'm gonna stay within my 1-inch margin of the border so I don't contaminate the sterile field. So I'm going to open. And I'm going to start with my dominant hand, which is my right hand. Okay, that is on. And since I have a sterile glove on, I'm able to touch the inner cuff and then this front part right here. I'm going to take my second hand. And since I'm sterile, I'm allowed to fix my fingers because I have not touched anything else. And I continue touching only the outside of the glove. I did not touch the inside. Since I have sterile gloves on, I'm just going to fix my sterile field. Okay, I'm going to start by taking things out that I don't need. I don't currently need a urine sample. Discard. Discard. Okay, I did not bring anything over the sterile field, so I have not cross-contaminated. I'm sterile. I'm just gonna move this back a little bit. I'm going to take the first drape. I'm going to open it. Since I am sterile, I can touch it anywhere I so please. I'm going to pinch 2 little spots. And this is just gonna go right about here. I'm not gonna ruin anything. I'm gonna take the second one and I'm gonna do the same thing, but this one is gonna drape over your vaginal area, okay? This side is. I'm gonna take my shiny side, staying inside my 1-inch margins. I'm gonna place it on the patient. And then I'm just going to expand it a little bit, make sure it's covering. I stayed inside my 1-inch margins. Now that that's there, I'm just gonna go ahead and get everything set up. I'm going to open my betadine. I'm going to open my lubricant. And I'm gonna grab my straight cath without letting it fall out of my sterile field. Okay. You're gonna feel my hand, it's gonna have a little pressure. I'm gonna open your labia, I'm gonna wipe each side and 1 wipe down the middle. And then you might feel a little bit of pressure as the catheter goes in. And then you'll just feel a whole bunch of relief as we're gonna express your bladder, okay?
All right.
All right, I have my dirty hand. This is gonna be my dirty hand, my left hand. I'm going to open my labia. I'm gonna grab my first of 3 cleaning swabs. I'm gonna clean one side. And I have a garbage can behind my recording partner. It went that way, so I did not contaminate my sterile field. I have another one. I'm gonna swipe this side. Did not contaminate my sterile field. And I have my third one, and that's gonna go right down the middle. And it did not contaminate my sterile field. I have my lube. And I'm just gonna move this a little closer. All right, remember that pressure I talked about?
Yeah.
You're gonna feel a little bit of this right now. I'm gonna insert the catheter, okay?
Alrighty.
So I'm gonna open it. Gonna insert it. Urine is gonna flow into the container that I have provided here. It's gonna flow, it's gonna flow, it's gonna flow. Urine has stopped. I'm going to remove my catheter. Discard. And then, since I'm done with the procedure, I'm going to take this, set this right here, and with my clean hand, I'm going to remove my items so I can accurately measure the urine. Since I'm done with the procedure, I can discard all of this, including my gloves. And then I'm gonna have a new set of gloves to clean up the patient. I have some wipes with me. I'm gonna clean on one side, clean the other, clean down, ensuring I don't bring any bacteria up to her urethra. I'm done cleaning. My gloves can be removed. I'm going to let you put your legs back down. We're done with that little butterfly position. I'm gonna cover you back up. All right, Mary, do you have any questions for me while I'm still in here with you?
I don't think so.
Okay, I'm gonna put on a new set of gloves. I'm gonna measure the urine. I'm gonna check for color, clarity, smell. And then I'm going to dispose of it in her bathroom, which is in her room. So, once again, I have my urine. I have little measuring devices right here. I said we had about 500 cc's in the bladder scanner from the previous nurse, and I see I have 500 milliliters of urine in my cylinder. So I have seen it. It is a good amber color. It's a little clear. It's not too dark. There's no floaties in it. So I'm gonna go ahead, dispose of that in the patient's bathroom, come back, remove my gloves once again, and I'm also gonna get rid of my little sterile field. All right, Mary, do you have any questions for me while I'm still in here at all again?
Nope.
No. I'm going to ensure the patient's bed is in a low position. Her side rails are going to be up, and I have given her her call light. All right, Mary, I'm gonna head out. Let me know if you need anything, and I will come check on you in a little bit, okay?
Alrighty.
I am leaving the patient's room, hand hygiening on my way out, providing for privacy, and then I'm gonna document.